Hi, my name is Lisa King. This is my video demonstration of my head to toe assessment. I'm using my daughter as my patient today. And let's see. As she walks over here, I can do a quick inspection of her general appearance. She has a very good posture, steady gait. She's following my instructions and sitting down. So overall, we'll start with her skin. Her skin's a very good color. We're looking for any abrasions or contusions, any masses, swelling of the skin. There's nothing obvious, a couple little old contusions here that's very typical in a child. She has a few little nevi across the bridge of her nose and across her cheeks. Otherwise, her skin's very good uniformed color. It's a nice tan. I can looking for any central or peripheral cyanosis. She doesn't have any, but I can look at her fingers and squeeze the tips of her fingers, checking for her capillary refill, which is less than 3 seconds. I always need to make sure that I'm doing that bilaterally, just in case there's a difference between the two. So her bilateral capillary refill and her hands are both less than 3 seconds. I'm going to ask her a few questions. I need to know her neurological status. So I'll ask her her name, where she's at, and if she knows the current date. So can you tell me your name?
Addison Key.
Okay, and can you tell me where you are right now?
At home in Kirby.
Okay, and do you know our current date?
August 6, 2016.
Perfect. So that just shows that she is alert and oriented ×3. She's answering my questions appropriately. Her speech is clear for her age, and there's no slurring of her words. We'll move on. So we'll start here on the head. We'll just look at the overall shape of the head. It's a good normocephalic shape. Her skin's, her hair is nice and shiny. Good, strong. It's not overly coarse. So the scalp looks good. There's no obvious redness or anything. We can palpate with the 2 hands across the head, just making sure that there are no masses across the head. We can also move on. We can palpate sinuses. So just with the 2 thumbs, we'll start, and we can palpate over the bridge of the nose, sinuses there. Right here, just at the inner part of the eye for her sinuses there. We can also palpate her lymph nodes, just a couple of fingers, and just kind of very small circular motion down. And just making sure that there's no lymphadenopathy or swelling of those lymph nodes. Anyways, next, we'll move on. We can, at this time, we can listen to the heart and lungs. So with that, we always, of course, we're inspecting the skin, looking at everything. So with the heart, once again, I look at the skin, making sure there's no central or peripheral cyanosis, making sure skin color is good. And then when we move on, we can do an auscultation. So we're auscultating the heart sounds. We'll just listen. And we start right here. We'll start at the aortic, which is at the second intercostal space, mid-line. Then we move over here to second intercostal space to the pulmonic. We'll move down to Erb's point, then tricuspid, and then down to the 5th intercostal space, mid-clavicular line, and this is actually the point of maximum impulse, and there we're listening as well. Especially in kids, we want to listen for any murmurs or clicks in the heart, so I have listened to her, and there are no abnormal murmurs, no swooshing, no bruise as well. We can also, while we're at it, go ahead and listen to her lungs. So for her lungs, we listen to 6 points on the front. So we'll start, and we're always listening bilaterally. And we'll start up here at the very top, apices, and we'll listen. We'll have her take a good deep breath in, and then we'll take a good listen, and then we'll have her to let it out. We'll always listen to inspiration and expiration, and we'll move on over to the other side. Deep breath in and out. And then we'll come down just a little lower, listening again, in and out, and then we'll move on. And then we come down just a little further to the outside, listening once again for her to take a deep breath in and out. We're listening for any wheezes, crackles, coarse and fine wheezes. We also listen to the back. Can you turn to the side here for me, honey? Go ahead, just turn that way so you can see the back. I'll let you stand up, sweetheart. Okay, so for the listening to the back, once again, we listen bilaterally. So we'll start up at the top and we'll kind of make a little C section. So we'll go left to right and then across all the way down. We just want to make sure that we get all the way down to the bottom of those lungs. Once again, having them take deep breath in and out each time, listening to the full inspiration and expiration. Okay, go ahead and have a seat here. Okay. With that, when we're listening or when we're looking at the heart, we also want to check her skin, the temperature. So her skin temperature is nice, warm, and dry. We're going to palpate her pulses here. So we're just putting 2 fingers just right here at the radial pulse, and we're just checking for good, even, bilateral, good pulse. Make sure pulses are nice and strong. When I'm doing that, I feel her skin. It's nice, it's warm and dry, and I can even pinch and just checking turgor here. We go back to, since we've already auscultated the lungs, because I always like to do that at the same time as the heart. With the lungs, we're always inspecting her for the work of breathing, you know, just how deep, how hard she's breathing. If she were having any difficulty breathing, this is definitely something we'd want to know and intervene on right away. So her breathing is nice, even and regular. And there's no stridor, no work of breathing with that. We can also move on and we'll go down to the abdomen. With the abdomen, we actually do it in a different, we do it in a different course than we do everything else. For the abdomen, we always want to inspect it first. Then we're going to auscultate it, then percuss, and then palpate. Palpating is last when it comes to the abdomen because we don't, if she's having any pain, we don't want to interrupt and have her guarding while we're doing our assessment. So we'll just inspect, so kind of have you lean back just a little, sweetheart, and we'll just pull up stomach, her shirt just a little, just to take a look at her abdomen. So it's a good, nice, flat. So as we're looking at it, there's no bruising noted. So we'll go ahead, we've inspected it, so now we're going to auscultate it. So with the auscultation of the abdomen, we always start down here in the right lower quadrant, and we need to listen for her vowel sounds. We can do it with the diaphragm or the bell. We can just push down just a little harder with the diaphragm, and I prefer to use the bell for the abdomen just because it picks up those other sounds. So we just listen, and we're listening for the type of vowel sounds she has, if they're hypoactive, active, or hyperactive, or completely absent. With the vowel sounds, we always need to listen for about a minute in each section. The regular active vowel sounds are between 5 and 35 in a minute. So as we listen, her vowel sounds are nice and active. Hypoactive would be more than 0 but less than 5 in that full minute. Before we can say that she has absent vowel sounds, we would need to listen for a full 5 minutes to determine that there are no active vowel sounds. So her vowel sounds are good. So after that, then we can go on to the percussing. So for the percussing, we'll just put our hands down and we'll just listen just for the different sounds that we hear. We'll expect to hear a duller sound over organs and hyperresonance in other areas. Once we're done with that, we can move on to light palpation. So with the light palpation, just a couple of fingers, and we'll just start nice, small. Now, if she were here and she was saying that she was having abdominal pain, we would actually do that section last. Are you having any abdominal pain?
Yeah.
Okay, so we'll just do a regular, just go in a nice little order. So we'll start here in the nice little light palpation. We're just feeling for anything abnormal, masses or swelling or any tenderness. If she was saying that she was tender, that's definitely something we go back to palpating last. So we do our light palpation just a couple centimeters in, and then we can actually move on and do a deeper palpation. Once again, we're feeling for any masses in the organs at this point. if she's having any tenderness. You can go ahead and sit back up there. We'll move on, and she's a female, so we would go over her genitourinary. We're not going to video that, of course, but we would ask some questions at this time. So for the inspection, we would be asking her questions about her urination, if there's any burning when she pees, if she's having any discharge, any blood in the urine, any pain, if she's having any frequency or urgency when she uses the restroom. As long as that's good, then we would just move on. Let's see. Next, we can move on to the musculoskeletal. So we're checking for her muscle strength. So with the muscle strength, we're looking for a full range of motion. So we would just inspect it, take a nice good look. All of her extremities look to be about the same size bilaterally, and very important to make sure that one side is not atrophied. So we would have her, and she can just raise your arms up, and we'd have her flip her hands over, and we could have her bend her arms, and she can stretch them back, and have her make a little windmill if she wanted to. There you go. Also have her do it with the legs. She could stand up, or if she wanted to lay all the way flat back, we could do that as well. Just making sure that the knees bend, and that she can do it all on her own. Making sure the ankles move, and then do the other one as well. And sit back up for me, sweetheart. One other thing that we can take a look at is when we're assessing everything, we also want to assess the eyes, ears, nose, and mouth. So with her eyes, we'd be checking her eyes, checking pupils to make sure that their perla is present. So we would check that her pupils are equal, round, react to light, and accommodation. So I would actually, we've got a light here because I don't have a pen light with me today. We would have her take a look up. Here, keep your mouth closed. Yeah, just keep your mouth closed. Hold your head up. There you go. And I would have her look ahead and have her look here. And I would just quickly do a light in her eyes. Gotta keep your eyes open. And I'd be making sure that the light caused her pupils to dilate. We would also be checking for nystagmus by checking the 6 cardinal gazes. So I would have her looking in one place, and I'd have her follow my finger only, and down, just making sure that there's no nystagmus noted. And she has no nystagmus noted. We'd also check the nose, checking for any drainage, if she was stuffy, if she was talking funny, caused by the drainage that's definitely something we'd want to assess further. And then we can also check the mouth. We'd have her open her mouth. We're checking for her oral mucosa, making sure it's pink and moist. And there's no cavities of her teeth that we can obviously see. No lesions on the tongue or the oral mucosa. Her lips are pink and moist. And all of that looks good. Checking her ears as well, we can palpate the pinna just very gently, and check the tragus as well, just making sure that there's no lesions, masses, or tenderness, making sure there's no drainage from either side, and that looks really good as well. So from this, we can also, when we're assessing eyes, if we were in a doctor's office or the ER, we could check with an ophthalmoscope or an otoscope for her ears and nose. With the otoscope, we take a look at the red reflex of the eyes, and with the ophthalmoscope, we could also check the ears and nose for any drainage or lesions or any foreign bodies. But otherwise, everything looks good, and so we'll end that there.